Looking at the sixth wave, and experts say a concerning number of children have faced hospitalization in recent weeks. Dr. Dina Kulik, founder and CEO of Kid Crew, joining me live now on what she is seeing. Good morning to you, Dr. Kulik.
Good morning.
It's now been some time that we've seen masking no longer mandatory for kids in that school setting. And now we're also starting to see hospitalizations rise, depending on where you are in the country. At your clinic, what are most of the parents and kids coming in for? What are you seeing?
Huge numbers of children and their families sick in the last couple of weeks, for sure, hundreds a day. And kids really have the whole gamut of symptoms we see with viruses and flu-like illnesses, from fevers to coughs to sore throats, vomiting, diarrhea. Lots of children with rashes during the illness or subsequent to the illness, and their parents as well.
And no doubt a lot of questions that we were talking in commercial break here, that a lot of these symptoms, because the testing's not there, maybe overlap with a cold. It could be COVID, could be allergies. So how do parents navigate all of this? And when they come to you, do they have those same questions?
Absolutely. It is difficult to tease apart what is what. I think if your child or you are having a sore throat, stomach flu symptoms like vomiting or diarrhea or fever, I would assume for sure that it is COVID. It is by far and away the most prevalent virus right now. If you have just runny nose or a tickle in your throat, especially if you've had a history of seasonal allergies before, it could be that, given that things are now pollinating and the trees are blossoming and the grasses are coming out. But because of the sheer prevalence of COVID right now, and of course, we don't really know the real numbers, I do think if you have any viral symptoms right now, it is best to stay home for at least 5 days, touch base with your healthcare provider, and get further counsel.
We heard the Ontario's Science Table saying, listen, we know people were getting together for Easter. And of course, they're a lot celebrating Easter again this weekend. And so we anticipate those numbers to climb. But did you anticipate, from what you see in, day out, that the hospitalizations rather would also be increasing?
Yes, of course. If we have enough people with COVID, you will see a rise in hospitalizations. And this is typically a lagging indicator. Oftentimes it's 2 or 3 weeks later after that rise in number of cases that kids and adults will get sick enough to require that kind of therapy in a hospital.
What's interesting, so looking at the latest data for vaccinations, so across Canada, it varies depending on the region. About 40% of kids 5 to 11 are fully vaccinated, and of course the younger population not eligible at this point. How big of a difference does this make?
It's a huge difference. We know that being fully vaccinated does help protect us from severe illness and death. And what I worry about is the waning immunity. Lots of adults that got 1 dose or 2 doses that haven't yet had their 3rd dose, people that are eligible for a 4th dose that haven't yet received it, kids that got 1 dose or maybe 2, and if they're teenagers, they're eligible for that 3rd dose a while ago but haven't received it. And then many of our children that are 5 to 11, like 3 of my own children, who should be getting a 3rd dose come June when 6 months is past their 2nd dose, and that isn't yet eligible for them.
Yeah, and there's no timeline on that one just yet, is there?
Not that we've heard.
Yeah, and I know there's so many questions, and I know I'm sort of throwing them all your way, and a lot of them are sitting in gray right now, unfortunately. But Dr. Kulik, I appreciate you taking the time for us right now. There's still a lot that we contend with. We've got to remember, we're still in a pandemic, right? So all the information is on our website, citynews.ca, breakfasttelevision.ca. Have a great day, Dr. Kulik.